Good day everyone, I am Mary Rose Garcia, a secondary nursing student from Section 1-Widenbach. So for today's video, I'm going to demo the infant's bath procedure. Infant's bath is washing the infant with soap and water. For the assessment, review general assessment data about the baby. Also observe for any signs of abnormalities. For the objectives, it is to clean and refresh the infant, also to promote circulation and comfort. To develop a sense of security, warmth, and love. Remove secretions and excretions to allow the inspection of the body for skin breakdown. For special considerations, prolonged exposure of the body can cause rapid cooling because the infant's temperature control mechanisms are immature. The infant's skin is thin and sensitive, requires gentle handling. So soap and other substances applied to the skin should not be harsh or abrasive. And third, powder is not indicated after bath, for it may be irritating to the infant's delicate respiratory tract. For the equipment, you need to have soap dish with a mild soap, and then the bath thermometer, the hairbrush, water, baby's dress, and the diaper. So first, you have to gather the necessary equipment since preparation promotes time management and an organized approach to the test. Next is to check the baby's temperature to provide the baseline data. After that, we have to undress the baby and then wrap using the mommy restraint to prevent the baby from unnecessary movement. And then we have to set it aside. So after that, we have to hold the baby in a football manner, wherein you use your one arm and then the buttocks of the baby are resting on the crook of your elbow, using your hand supporting the neck and the head of the baby, and then while the free hand is used to soap, rinse, and dry the scalp of the baby. So holding the baby in a football manner prevents the baby from falling. So next, we have to fold the outer ears with the thumb and the middle finger. So this is the thumb, a fold, and then the middle finger. So this is to prevent the water from entering the ears that may cause ear infections to the baby. So wash first the head with soap and water and rinse thoroughly. So mild soap is used to prevent harmful effects to the skin. And then the soap. So this is our soap. And after that, we have to rinse it. So make sure to rinse off the soap in order to prevent harmful effects to the baby's skin. So using the folded part, we have to dry the baby's head in order to prevent from chilling. And after that, we have to place the baby on a crib with a diaper to prevent from falling. We have to proceed to the entire body with the arms, the chest, followed by the abdomen, the back, and the legs, which is gently washed with soap and rinse and pat to dry. So, washing the skin, especially the folds in the neck, the axilla, and creases at joint are important to prevent irritation that may be source of infection. So, in washing the infant, I use this cloth and then I soak it to the water with soap. Then, wash the infant's arms first. And then, use another cloth for the infant's abdomen and back, as well as the chest. And also the legs of the patient or the baby. After that, I will use another towel and then soak it into water in order to rinse the soaped area. And then, after rinsing, pat to dry. Up to down. At the back. And then the legs. Also, the buttocks and the genital areas are cleansed last. So, any fecal matter is removed with the tissue paper before washing. So, the groins are given special attention. And then discard. So, use the tissue to remove the fecal matter. And then, after removing, proceed to the washing of the baby's genital areas. Up to down. And with the same procedure, rinse and dry the baby to prevent or avoid chilling. Pat to dry. And after that, dry the infant. So, shirt, diaper, and any additional clothing appropriate to the environmental temperature. And this is to provide warmth to the infant. So, I fold the upper part of the baby's diaper in order to not touch the cord of the baby. After providing warmth to the baby, comb the baby's hair. After that, we have to do the cord dressing for babies still with cord and especially with wet cord stump. So after the cord dressing, I already put the baby's dress, and then we have to position the baby either on his stomach or on right sideline position on his or her crib. So this position facilitates movement of food from the stomach to the small intestines, thus facilitating digestion and regurgitating of food. For the evaluation, the baby looks clean, the baby's skin is intact, and the baby is comfortable. For recording and documentation, record time bath is given, and the signs and symptoms observed, the baby's condition as well as the signature. So that would be the coverage of our infant's bath procedure. Thank you and God bless us all.